down in the mat, and I don't care where I do. I love concrete floor. I do in the concrete floor. At home, I do it in a hardwood floor. And she's right. We all do with a barefoot. And the reason for barefoot is very important. I just had a session, it's called your yoga therapy for peripheral neuropathy. So, because all of us getting, what peripheral neuropathy is? You start losing the sensation on your feet. And number one reason you're feeling sensation, because your nerve functions are going down. But more and more you get in touch with the ground, your sensation starts to come down. So what you know about yoga is, let me just explain a little bit to you, then we'll do very simple practices, which we'll do in the chair, and then we'll finish before 4:30, so you can have some question and answer. A small group is very nice. First, the word yoga, it's a shame to say yoga, This is original Sanskrit word, Bengali word is yog. So what happened in yog is that in West, not in that much in United States. United States are very adaptive. I have seen in Europe, they cannot say yoga. I don't know why, but in the moment you put a one A, oh, beautiful. You can say yoga very nicely, that's where the whole yoga came up. Now the worst thing is, all in India is also yoga. Nobody calls it yoga anymore. Doesn't matter where it is, in West Bengal, yoga. Bangladesh, yoga. Anyway, so yoga it is a union of your body, mind, and spirit. আমরা বলি শরীর, মন and আত্মা. এটা originally derived from your Veda. It's in Rig Veda there is a mention of yoga, but most of the philosophy of yoga is derived from your Atharva Veda, because Atharva Veda is the one which has origin of Ayurveda, Shalloveda, Stapatya Veda, you name it, all came from Atharva Veda. So yogic philosophy and Vedic philosophy is synchronous. There's no difference. So if you really know the Vedic philosophy, you know the yogic philosophy. It used to be your oral tradition. Oral tradition means Guru Shishya Parampara. Then one person, one rishi, wrote it down. And the person who wrote it down, his name is Patanjali. So Patanjali wrote it down first as a philosophy. It's called Yoga Sutra of Patanjali. Sutra means small aphorisms, and there are 196 aphorisms, and interestingly, 193 of them are to quiet down your mind. So it's all about mind. And why all about mind is that after I've been studying for years and years and getting deep into it, and as a physician I figured it out. There's already engineering and computer science people. Body is the hardware, mind is the software. And our spirit is the programmer. So who is the programmer? I am the programmer. I'm going to program my software to fix my hardware. So if you fix a corner, I'm doing angioplasty, I'm doing a bypass, I'm giving all the medication for diabetes, hypertension, everything, I'm trying to fix that hardware. The bug is in the software. So bug is in the software, what you do, you get a iOS 16.3 updates. So you do the software updates. A daily practice of yoga is a software update. It really takes up all the bugs of your software. And the practice is called 8 limbs of practice. It's beautifully practiced. It's called your Patanjali Ashtanga Yoga, 8 limbs. The first one is called Vyam, মানে সংযম। সংযমটা আমাদের কি ছিল? মনে হচ্ছে আমাদের সে অহিংসা, সত্য, ব্রহ্মচারী, Brahmachari, people talk about all different way, but Brahmachari, Brahma is a supreme being, and Charya means your gain to king. It's the really what the Brahma has lives, the life, and that's a life you live that causes you're quieting down your mind. Osteo means not stealing, and oporigraho means non-attachment. Second, niyam. Niyam is the one. First was a very, very beautiful way it is all described. Santosh. Santosh হচ্ছে যে quieting down your mind. Shoucho, cleanliness. Once you are clean, your mind quiets down. Tapo. Tap হচ্ছে একচুয়ালি আমরা বলি না তপ হচ্ছেন। তপটা হচ্ছে able to control your five senses. Our mind is nothing but a content of the five senses. Shabda, sparsha, roop, ras, gandh. এই যে পাঁচটি ইন্দ্রিয়, its feeding is called ahar. Ahar is not what you take. So you need to control your five senses, and that's what we'll practice. How to control your five senses. And how do you go through the stages. Asana is very important. Asana is your alignment. Alignment means your internal, external alignment. And most important asana is your, it's called Sthiram Sukham Asana. Sthiram means stillness. তুমি এখানে বসে আছো, you are still. You are not doing these things, you are not doing these things. Why? Because you are in asana. Asana, the chair বসে আছো, that the chair, sitting in a chair is also called an asana. It's called Utkatasana. And why you are comfortable sitting in chair, Sukham. Sthiram Sukham Asana. আর আমাদের কথা বলি না এই আসন করে বস, এটা আমরা সবসময় বলি এটা আসন করে বস. So it's a very common term, and the phenomena is called neuroplasticity. Neuroplasticity means a habit forming. Oh, I cannot sit down when my knee is hurting. Okay, knee is hurting, don't sit down, but try. How do you try? That's what I'm going to tell you. You'll see in stages impossible become possible. I mean, we are like a stick. You cannot even bend, you cannot do anything. You're like a stick. Now you're like a rubber band. You name it, you could do it, anything. So asana, pranayama is the most important component. Pranta হচ্ছে আমাদের, it is a life force. আমরা বাংলা সবসময় বলি এই প্রাণটা বেরিয়ে গেল, হ্যাঁ? প্রাণটা কি হলো? And we have no idea as a medical doctor what prana is. We know it's an energy, some kind of energy. Keeps us awake, alert, alive. But most important thing what you know is that breath is the carrier of prana. Breath is not that. It's like electricity, like prana is electricity and breath is your, like the electric cable. It is carrying the prana to your body in and out. So pranayam, ইয়া মানে হচ্ছে সংযম. প্রাণকে যে সংযম করে সে হচ্ছে প্রাণ. So you'll see in all the West, we're doing a breathing exercise. It is not an exercise. It's called a voluntary regulated breathing. You learn how to do it slowly in stages on your own. Fifth limb is called pratyahara. Pratyahara is the most important. Pratyahara. Ahar means all the inputs. Inputs are what? Five senses. I'm hearing, I'm seeing, smell, taste, and touch. The moment you learn how to control your five senses, because mind is the content of your five senses, your mind quiets down. And you know very well, if I hear something, I'm going to turn my body. So I'm hearing, then I'm looking, I'm using. So I'm using all the senses by hearing something, it keeps my mind very active. So pratyahara is very important. Sixth step is called a dharan. Dharan is a focus. So you start your mind in a focus, and seventh limb is called your dhyan. That's a meditation. People all come and says, I want to learn meditation. Oh, I want to meditate. Everyone. And I teach a lot of doctors. So that's a primary thing I do. I want to learn meditation. I want to teach my patient meditation. I said, there is nothing called yoga and meditation. Meditation is the seventh limb of yoga. So if you come to all the stages, meditation will automatically come to you. I'm going to meditate. I'm going to close my eyes. I'm going to, follow my breath. Yes, but your body is not ready. You are doing the body. The mind is not going to work. And the eighth limb is called samadhi. Samadhi is the union of your body, mind, and spirit. Ninth limb is called Mahasamadhi. Probably you know what that means. So the practice, what they came up, is a very simple practice came up. The practice was designed for outcome was for self-realization. But the people who are practicing it, they had a health benefit. And that health benefit was taken out and used as a therapy. That is called what yoga therapy is. Now I tell you, I'm sure you have seen. You go to Ramakrishna Mission, see the Swamitis. 95, 98, 100, most of them, except Vivekananda, if you see, what happens, they are in a state of meditation. And another quality, which you won't believe unless you see, they eat only 1 meal a day. Lunchtime, আর কি খায় ওরা? একটু খিচুড়ি। রাতে একটু ফল, ঘুমানোর আগে একটু ফল খেয়ে ঘুমায়। So we will talk about it and what we find it out. So the first concept is you learn how you'll be able to sit down and be comfortable. So the number one symptom is you have to listen to your body signal. The first signal would be pain. Sitting down here, you get a pain, you back off. Because pain is going to keep you awake and alert. So I am putting my feet high up here, so it is hurting. So I'm not going to progress. What will do? I'm going to go back. I'm going to find a place where it is not hurting me. But I like a little discomfort. Got a comfortable discomfort. No pain, no gain doesn't work in your life. But most important thing what it is that this is called a relaxation response. By the time you're able to keep it for a while, you will see initially your muscle will contract, come up here. And muscle cannot stay contracted that long. Muscle is going to relax. So your body will be flaccid and flexible. That is called relaxation response. And what it does, it generates a physiological mechanism which is called parasympathetic activation. What is a parasympathetic activation? It's called calm and digest. All of our lifestyle-related disorders, diabetes, hypertension, heart disease, you name it, is all due to our sympathetic overdrive, which you call stress. The hormone of stress is called cortisol. And cortisol is the reason for all of our diabetes, all of our coronary artery disease, our hypertension. Let me tell you a very simple example. Cortisol is a prednisone. So if you know anything, anybody, if you give a prednisone, the blood sugar will shoot from 100 to 500. And here getting into the level of cortisol all the time, and everybody is saying my blood sugar is up. My blood sugar is up because of your cortisol. Yeah, I have a genetics, I have this, I have a insulin resistance, I know all about it. No question about it. Two things happens for diabetes. Number one is a high level of cortisol. Second, body cannot digest sugar. So this parasympathetic activation is called digestion. Our whole gastrointestinal tract is supplied by digestion. So the parasympathetic tract. So they start initiating a practice who has never done. I see people coming to my class, it's a big class. First of all, they never heard of what yoga is. Second, they come with a oxygen mask, they have the oxygen cannula, they're sitting in a chair. So the first component is you learn how to sit down with the spine straight. It is called Merudanda Achal. Merudanda Achal is an absolute must for our daily life. There is no shortcut in Merudanda Achal. Why? If you see somebody 90 years, 100 years young, you will never see the kyphosis. You will see this. Because was our grandfather, probably 6'4", God knows how long, he lived long, absolutely straight. You will see people really, we call it obese, bulky, fat people. I'm not saying look at them. Their spine will be straight. They're as functional as healthy can be. And here this one, with a little kyphosis, is the end of the beginning and end of it. So Merudanda Achal, next to monosthir. এই মনটাকে স্থির কর। এখন মনটাকে সবাই সবাই বলে আমার মন তো চঞ্চল কি করে? You have 5 indriyas, pancha. One of the most important component is your breath. Why? Breath is connecting your body and mind. Our lung has a 6-liter capacity. It needs 1.5 liter to keep it open. We have 4.5 liter which you can exchange. Guess what? With every breath you take, you only exchange 500 cc. So 500 out of 4.5 liter, that means lung has a 90% reserve. So first you learn how to breathe out. You go to Western exercise club, take a deep breath in. If you take a deep breath in, that air is not doing anything for you. Why? Because you already have a 4.5 liter of air sitting in your lung. So you have to first learn how to breathe out. So all yogic tradition you learn how to breathe out. Then you slowly take a deep breath in and learn how to breathe out longer than breathing in. So what is the longer does is that longer will empty your lung, so get a more oxygen in, and oxygen is a muscle relaxer. What does it mean? If you get a back pain, the back pain comes from tightening of your muscles, and you put a heating pad. You know what heating pad does? Heating pad opens up the blood vessels. It brings more oxygen in. It causes relaxation. So you sit down, even if you have to sit down, like see, and actually I didn't bring it, but I have it in my car. I'll show it to you what I have. Even if you have to sit down in the back, always sit with the spine straight. And then we have a stool, it's called a kneeling stool. I don't know if anybody has seen. I had it for years and years. In fact, my one is in the car. Maybe at the end, we'll get it and show it to you what the kneeling stool looks like. All of you work in a computer. It's absolutely must to keep your spine straight. You won't believe the kind of people we see for lifestyle-related disorder in India, primarily all IT people. And we believe it's primarily hunchback and looking like this. So we instruct them to get up. So we put them on a kneeling stool. In fact, recently a person, when he had back pain, he called me, I told him to get a kneeling stool, and he got so better in a few days, took it to the office, had one at home, one in the office. Then his wife says, oh, I want one too. So she ordered another one. So he called me, so I said, I have ordered 3 of them. You can go to Amazon and stick a kneeling stool. So, Merudanda Achal. একদম সব সময় মানে what I personally do, I wake up in the morning, You don't have to do it, just to take a look at it. What I will do, I will put my body against the wall. I put my ankle, then slowly I will be, slowly keep my eyes closed, and I do a simple breathe out first. Take a gentle breathe in and breathe out without any effort, effortless. That slowly I put my whole body against the wall and I stay here. Then I keep my whole hand high up. This is my first practice when I wake up in the morning. And this practice, the practice of yoga, what you have, you are going to do it throughout the whole day. And the reason is, when you keep on doing, you're feeling amazingly comfortable. If you want to know what shuk is, this is shuk. You know why? বাংলাতে আমরা কি বলি? অসুখ হয়েছে। অসুখ. When the shuk is gone, it is shuk. আর আমরা কিছু বাঙালরা কি বলি জানো? ব্যারাম হয়েছে। Huh? You know where the Baram came from? Be-aram. Be-aram se Baram aayi. Punjabi mein bole tandurust. Tandurust ho gaya. So ei je shobdogulo, this is very interesting. Amra bhalo na. Dhoro ami bolchi যে health, স্বাস্থ্য, স্বাস্থ্য হলো স্থির. Stillness in your body, mind, and spirit is health. So first you able to sit down in a spine straight. Then what it does, your hand connects your body and mind. What does it mean? If you notice somebody, if the mind is active, hand moves first. If you see somebody, oh, food is good, the food was good, you do this thing before your tongue moves. You know, food is good. Or I would say, hey, I'm going to put down. But put this. Why? Because you'll be surprised to see half of our brain controlling body controls our hand. It's amazing. If you see this called a, you know, the homunculus. So hand is absolutely, in yoga is called a mudra, hasta mudra. So all of them will touch index finger and thumb. This is called your Gano mudra or a Thano mudra. So the moment you touch it, you will feel a sense of calmness and quietness. So touch your index finger and thumb, just put it over your knees, and next thing you close your eyes. The moment you close your eyes, you are trying to quiet down your senses. Next is, you bring your awareness to your lungs, your breathing. Breathe out first. Slowly take a deep breath in and breathe out longer than breathing in. You do it a few times, you'll see the relaxation response will slowly set in. When the relaxation sets in, then what you do, you will do in stages. You don't have to do it. I generally do it in the floor, but since all of you are in a chair, let me show you how we progress. Our progression will be, this is called a neuroplasticity. When you keep it for a while, we will be putting, say, one feet under the knee. This is called your Sukhasana. And if you're comfortable in the floor, is good, you know. I mean, if somebody put a mat, or maybe, you know, I really don't want you to do it, but if you can, oh, that, okay. Can somebody tilt this my laptop so you can see? Can you see the picture? Tilt it so you can see. Or just tilt that. Yeah. I'll put it in the center also. No, just. Yeah, gotcha. Okay, no, you sit in the chair. You don't just as chair. I'm just showing it to you. What I'm going to show it to you, what happens in a practice. Called in stages, impossible become possible. So after a while doing the same thing, I'm not going to repeat because I'm going to just give you the concept to bring you. Then I will share all my YouTube videos, how to start a asana practice, how to start a pranayama practice, how to start a meditation practice. You will hear it at the beginning, bring it in your head, and then you practice it daily. It is a day, and it's not that you have to do it, you know. You're working, even you're cooking, you know, that's your yoga. In the morning I say, Shekhar, I'm doing a kitchen yoga now. No? So, you feel, so it's hurting you. So what do? You back off. You find a place where there is no pain and even effortless breathing. Breathing is very important because in yoga, heart and lung is the same organ. So the moment you put a stress in your body, you're putting a stress in the heart. The moment you put a stress in the heart, you put a stress in the lung. So you get effort in breathing. So I've seen the yogis sitting next to me, they're breathing, you don't even hear their breathing. Next thing, the biggest issue today, especially in life, is our balance. We are all losing our balance, and loss of balance, in fact, the fall, number one cause of death in the seniors in this country. And the reason for your loss of balance is all, you know, Western medicine is great, you know, muscle instability, everything. Non-functioning of the other side of the brain. We have two brains, right brain and left brain. I'm right-handed. Right foot, I'm going to show it to you, what I do for every single day. You have never using your other side of the brain. You've never used your left hand. So the moment you start working both sides of the brain, the balance comes back. A simplest technique how to bring the balance back is to change your foot and sit down. And you see, you'll be a little uncomfortable for you to because you have never done it. And you will be surprised to see every time, you know. But the moment you do opposite side, oh my God, what happened to me now? Okay, but try it. It will come to you. You're activating the opposite side of brain and activating different group of muscles. Sukhasana. Next step is called Siddhasana. Take your heel all the way to the back. If you cannot do it, please don't do it. I'm showing it to you. What you're looking for? Pain. If you get a pain, you don't do it, okay? So, this is your Siddhasana. Good job. I'm impressed.
No, this one is.
Good job. So, this is Siddhasana. Now, what is my left hip was it like with the right hip? Opposite Siddhasana. Taking you to the really path of yoga, huh? Amazing. Ardha Padmasana, or half lotus. Ekta pa uthe gelo. Very good. It's hurting me. So what I do again? Back off.
Yes.
So if it is not hurting you, stay where you are. And if you keep on doing it as a daily practice, it will be as simple as it is. I do it every single day, so I don't have any issue. People ask me, how long do you do in the morning? I said, who cares? He said, why? Because I said, we have a special title. You don't want to know that title. Special title is called retired. You know? You heard that word before? No, a very nice word. So, you see that? Ardha Padmasana. Beautiful. Now go to the again opposite side. Ardha Padmasana. You cannot believe how relaxing this is because you are not getting in there if your body is tight. Body will let you get in there. And I get to hear all the time. Like yesterday, a lady called, she said, I used to sit down, now I cannot sit down. I said, I could used to do a lot of things, I cannot do anything now. But if you try, your feet will go high up, you'll be able to sit down in a Padmasana. I didn't do anything. I've tried it. No, don't try it in the I didn't do anything, you know why? It came to me. I paid attention to my mudra, I paid attention to my breath, I paid attention to my five. Good job. Look at her.
Those are very cold.
It is a very cold. Number one. The reason I said that if you have a pain, you back off. But it's not only the pain, any sensation. If you stay here a little longer, you might feel a numbness here. The moment you get a numbness, you back off. Any sensation you get, you listen to your body. And most important thing you do is that, please, don't practice after taking a pain medication. There was an advertisement. Advil. Oh, look at Advil. Yoga teachers, they are having little aches and pains, so we told them take 2 Advil and do a yoga practice. So we just came, I was the president of a big organization, so we just came, they withdraw that ad. I said, because, see, the reason is, in yogic tradition, they think the pain comes from tightness. I have on the knee, my meniscus tear, my cartilage tear, my bone goes, none of them has a pain fiber. Cartilage doesn't have any pain fiber, meniscus doesn't have any pain fiber. What happens when there is a damage? Body tightens up. It's the ligaments and muscles which have a pain fiber. So the tightness causes pain. So relaxation. So the first relaxation you start in your practice is that the most relaxed person you have ever seen, you have no idea who they are. The babies.
Yes, true.
The babies. And do you know the babies do yoga?
All the time.
All the time. They will get up into a cobra pose, they will get up into the downward facing dog. And we have our 2 grandkids, and both their parents are yogis, so they have been training them. First thing, they should come to my room, I will show it to you how to be like a baby and practice exactly what he does. One of my friends is a radiologist. He was doing all the ultrasounds of pregnant ladies, and he said, you know what? The babies even do yoga inside mother's womb. That's the only way they can be, It's called a Pavan Muktasana, knee chest.
Yes.
And then he said, they became so expert yogi and yogini, they come up with the Shirshasana, the headstand,
Yes.
The head comes out first. The first you start relaxing your hand. See, you do in sequence. You will do it sitting in a chair also, or sitting in the ground, that's okay. Have you ever seen how a baby's close their fist?
Yes.
Good job. I have not seen too many people observing this. Baby always closes fist like this. They will scream and yell like this. Okay? And in yoga, this is called the adhimudra. It opens up upper part of your lung. In fact, when you touch the index finger and thumb, and you put your hands down all the time, chin mudra, it opens the lower part of the lung. If you close the other finger, it's called chinmaya mudra. It opens the middle part of the lung. And if you do the adhimudra, it opens the upper part of the lung. So if you have to practice, put your hands in front and do the breathing. Breathe out first. Take a slowly deep breath in, breathe out. Then you do the eyes closed. The moment you do your eyes closed and follow your breath, you will see that relaxation will send in and money back guarantee. Any hand pains will go away. You have a hand pain, keep doing Adi Mudra, there will be no wrist gets relaxed with extension. So breathe in, it gets tightened up with a flexion. I'm going to show you very few simple things so that you can continue in your daily life. You know, the elbow actually gets tightens up. This is called external rotation, and it relaxes into. So if you have a pain in the elbow, try to put your hand inwards. And this is called a tennis elbow. You know, tennis elbow, whatever. You put a tennis ball and hit, so it is like a tennis elbow. Shoulder is a ball and socket joint. The shoulder gets relaxed with your rotation. So what she's doing, put your hand, bring your elbows here together, breathe out first, slowly take a deep breath in, and rotate your breathing out. Always follow your breath. Breathe in, breathe out. Breathe in. Next, you do again opposite, activating other side. Breathe in to the opposite way. You can hold your hand way high up. Breathe in, and see if you can slowly pull it down behind your head down. Always with the breathing. And the same exhalation, bring it up. Breathe in, breathe out, opposite side. And slowly, if you keep on practicing, to come to you. And all the aches and pains, we can guarantee you, those are the two ailments we are suffering. Pain and loss of balance. And we'll show you a few things that will bring them up. Whole upper body will get relaxed. It's a beautiful asana which children should do, babies do all the time. I don't know if you get fishing here, okay. So let me turn around and show it to you. You guys stay here, I'm turning around so you'll see. Paschim Namaskar. Paschim Namaskar is such a wonderful experience. Sit in a chair, sit everywhere. Slowly bring your hand close to you. If there is no pain, effortless breathing, slowly put your hand in a Namaskar mudra. If you can hold it in a Namaskar mudra, you can put it here. Then, if you're watching me, 1 month, 3 months, 6 months, sometimes in your lifetime, you'll be able to do it. What this is going to do to you, if you're an IT person, money back guarantee. I call it a 20 minutes break. No pain, don't do it. It will come to you. I had a fellow, he was an IT guy, one day he sent me a text message. I'm in a AFK, 20 minutes. I have no idea what AFK stands for. You guys know anything what AFK? Text message, text language? Called away from keyboard.
Oh.
So I said, if you're away from keyboard, do Pashchim Namaskar, okay? And when you get into this relaxation phase, like what I'm doing now, I would be in this asana, you name it. I could be the whole day. Because I'm getting that neuroplasticity has set up on me. So sitting in a chair, you do. Second thing, what I've done it, and all of you should do it now, that if you are sitting in front of computer for the whole day, you get a motorized table. You get a motorized table, bring it up to a height that you'll be sitting in a chair. It's called your kneeling stool, so that your spine is straight. Then your keyboard is here, and you're looking at as if your spine is straight. Very important. And then the concept of standing up desk, that motorized standing up, and then with the concept of your treadmill during walk, that has gone away. They tried, it's not, they couldn't market it. But motorized is very important for the day. So we'll go up till say 20 more minutes, so I'll show it to you. So that, because you have to leave by 4:30 here.
Yeah, just put the chair back, that's all.
Okay, that's all. So yeah, close. Because I want you to get this concept so you can do. So sitting in a chair, just do it. This will totally relax your respiratory muscles. So what it will do, it will totally get it breathing. Next thing is the most tightest part is your neck. So this is called your Brahma Mudra. Brahma Mudra is the 4 steps of your neck, which you will do with your breathing. So for example, first one is front and back. So breathe out first, slowly take a deep breath in, put your head to the back. Breathe out, slowly drop your head down. What you're looking for, pain and effortless breathing. Slowly bring it up. Now people always ask me, what does effortless breathing mean? In effortless breathing, you will be able to talk. You will be able to sing. So every asana pose I do, I talk, I sing, I do everything. This is number 1. Number 2 is side to side. Same breathing sequence. Breathe out first, take a deep breath in, put your neck on one side. No pain. And the best way to do it, since it is a non-competitive, that means, come back again, do the other side. Practice of yoga is a non-competitive. That means you are not competing with anybody. So what you are doing with your eyes closed. So you do it a few times when you do it in the morning, and you slowly will see your neck will get relaxed. Number 3, look all the way to the back without turning your shoulder. So breathing out first, deep breath in, and look all the way to the back without turning your shoulder. And the same breathing cycle, you come back into the middle. Same way, breathe in the middle, breathe out. Since I'm showing you the technique, you go ahead and do it a few more times at home. And because of lack of time, let me show you the next one. Is your slow rotation and very simple, gentle rotation. You drop your head down, breathe out first, take a deep breath in. Slowly put it in the left to the back to the right. Put it in the left to the back and slowly to the right. And then next will be opposite, right to the back to the left. So it is a beautiful and simple practices which will totally relax your whole body and mind. And other very interesting is what you surprise, it is not a Western concept of reduction. It's reduction is I'm relaxing my neck, I'm relaxing my hand. When you relax your neck, relax your hand, your whole body gets relaxed. So the pain you have, in a back pain you have, from your tightness of the muscles, get relieved by when you're able to put a Paschim Namaskar and do a Brahma Mudra. So in the leg you can put your feet in the front. Very interesting way of just doing it. Separation of the toes or relaxation. So separate your toes, you breathe in and then breathe out. Market is full of it. I don't know if you've seen. Called yoga socks, yoga shoes, yoga toes. These are all the separation of your toes. Then I should have bring all of them. I have the yoga socks, yoga shoes, yoga socks are for a vibration.
Maybe get a nails done.
Yeah.
Ankle, very important. Breathe in and breathe out. Why ankle is very important? Because it's your weight-bearing joint. People all talk about hip, my knee. At our age, half of the people have already knee replacement. And initially they feel great. But after a while they said, I don't know why I've done it, It's very simply because knee and hip, it transmits you weight. It is not a weight-bearing joint. So by replacing those joints, unless there is a lack of function, next your whole body will relax, what is called your Paschimottanasana. Slowly see how far you can come down. You can touch your toes. Great. Then what you do, you slowly try to body and try to look in front so you don't bend your spine. So when you come down slowly, you can look, I can come down, I can even clasp my hand. Okay? And slowly coming down, your head will come and touch your knee. Generally, we like you to stay here between 5 to 10 breaths. Do you understand? 5 to 10 breaths is very, very important. So this is a very simply, you put your hands in there, eyes are closed, but be sure your breathing is effortless. Next what you do, just for your daily practice, it's a very important. All the foot pain will go away. And people say, how? Able to separate your toes. Put your finger and say you can separate your toes. Initially you won't be able to. It's like, oh, it is so tight, nothing goes to there. But slowly go in and out. Separate, the tight shoes. What happens that if you can separate your the front of your feet gets separated. So your weight transfer is like an arch, weight transfer gets separated in front. Now, I'm not marketing, but have you seen a Birkenstock all wide in front and have an arch support. It's a wonderful function. So here, see, I'm sitting down. I do it all the time. I'm sitting down. I'm here, take this baby up here. Slowly lift the baby down all the way to the ground. Nothing doing. Very good. As I said, by the time you keep on doing it, and you'll see how comfortable you get. And again, balance it. So, the opposite side. And you'll see the babies do the same thing. They'll put the high up and they'll drop it down. Okay, now, most important, don't push it down. Because throw it, if you push it down, you come back again. So all these adjustments, what you see in the Western yoga studio, those adjustments are never done in yoga therapy. Baddha Konasana, closed angle pose. You can go, you just can stay there, you will be able to do it. My concept is always keep your spine straight in any way you can. Your feet together and keep slowly bringing it. You talk about knee pain, hip pain, back pain, head pain, mind pain, money back guarantee, huh? All will go. It's also called a Titli Asana, butterfly. And if you keep your spine straight, eyes closed, you will see that your knees are coming down to the ground. It's an amazing practice. It'll slowly come down to the ground. There's no rush in it. The one very important after the relaxation, what we do, you can do a very simple way of doing it, is that at the morning you keep a chair so that what we are doing, we are going against the grain of our habits. What is the grain of our habits? I'm right-handed, right-footed, but creating all the imbalance of it. So, I'm comfortable standing like this. And yoga says anything you make you comfort, do the opposite. Aram, haram, hari. Take it though. Put a food in your mouth, if it tastes good, spit it out. Karola khao. So what do? You put your feet together. See how you feel. So keep a chair just to be, because you're not used to it. I don't need it, but then I'm just showing it to you. Then move it a bit.
Oh,
sorry.
Sorry.
She's a wide angle vision. Very simple thing you do, see if you can stand on your non-dominant foot.
Left.
Non-dominant foot in that initiate. Oh, this is very simple because you've been doing it all of your life, So non-dominant foot. Oh my gosh, it is so unstable. 5 seconds, 10 seconds. I'm showing you. I'm not doing it, 5 seconds, 10 seconds, 20 seconds, 40 seconds. Then you will do the most impossible thing in your life. Close your eyes if you can do it. Close your eyes if you can stay on one foot.
This is the most inclusive.
Yeah.
Oh yeah.
I can do it.
You can do it. Beautiful.
I can't.
You cannot? God,
I
I
can do
cannot
it for
do
some
either.
time. Sometime, that's all.
And why cannot we do it? Because this is the state of your mind. Why? My vision is my balance. So I'm taking away my vision. So I'm trying to training my brain to side of the brain. So same way, always do to the opposite side. It's good. Then slowly you'll be doing, if you can, three pose. It's good. Okay, that's good. That's good. It just you keep it next to a wall, next to a chair, and always do both sides. That's more important. To be balanced. Beautiful tree poses. And then what you do here, since it looks like a couple of you are very expert in it, so let me show you one expert technique. In whole yogic concept, if you put your head below your heart, your body function improves. Why? Medically speaking, when you put your head below your heart, the pressure inside the head, called intracranial, goes high up, pressure inside the eye goes up, pressure inside the blood vessel goes high up, you feel miserable. Your whole face gets red, flushed, you feel miserable. But if you stay slowly in stages, your intracranial pressure goes down, intraocular pressure, eye pressure goes down, intravascular pressure goes down. So these are called baroreceptor sensitivity. What is baroreceptor sensitivity? All of you guys are in a beta blocker, ACE inhibitor, aspirin, statin, the standard things everybody in. These are all covered. So what you do is slowly, if you can say, it's called Utthito. Uttanasana. And if you can slowly put your head down, don't push yourself too much. What are you looking for? Pain and effortless breathing. Hands in the ground. Okay, here comes your test. All the way down to the head. Arms down. Prasarita Uttanasana. I'm talking, I'm breathing, I'm totally functional. I'm coughing. What do you need me to do? I can do everything on this place. So, this is my beta blocker. My cardiologist knows.
Good job.
Very nice. Don't push too much. It'll come to you. Stay here, it'll come to you. Okay.
Almost. Oh,
But let's be in a
a few more weeks.
Okay.
You will be there.
That's enough with the asanas, huh? Okay, if you want to take one message home, it will vary from people to people, but it's between your 20 to 30 inputs. That's called neuroplasticity. Neuroplasticity means you keep on doing the same thing, you'll be able to do it without the effort. So in English you say disease. This is. You put a hyphen there. Bangla ki boli? Ashuk. Bera. This is. So what is the treatment of disease? Is called effortless ease. So here I am. I'm in effortless ease. You tell me, put my head down. And like for me, I do every single day. I do a headstand. I do Shirshasana. So you do Shirshasana? You're going to kill yourself? I said, I know I'm going to kill myself. I practice only what my body will allow. In my class, there was a lady. Oh, she was so funny. She says, my husband asked me not to do Shirshasana. I said, why? She said, my husband told me my health insurance will go high up. I said, great. Lung, breathing, pranayama is the most important aspect of it. Once your body is totally relaxed, now we can turn. See, before, I have something here, I'll think 3 times to pick it up. I have something, I'll pick it up. And most of the people who are in my class said one very important thing which I love. Now I can play with my grandkids. I can play with my grandchildren. It is a wonderful experience. I said, you know what I tell them? I said, playing with grandchildren is totally parasympathetic. You know why you're parasympathetic? Because you have no responsibility.
Yes.
You spoil the grandkid, give it back to the kids, So first pranayama is called Bastrika. Bastrika is a bellows. So you have to learn. So you sit down with your spine straight. Bellows is your hapur. Anybody has seen? You're all city people. You've never seen one hapur. Okay. You put the bellow 2.
আগুনটা বাড়ানোর জন্য
Blacksmith, right? You got it right.
So amazing. One day, one of my friends, she said, I have a gift for you. I said, okay. I don't know if you guys remember, Mary. So I get the gift, open it up. It's real bellows. I said, Mary, where did you get bellows? She said, where else? I said, what? Like Amazon.com.
Amazon, yeah, I get everything.
So think about what the Hapo does, okay? It's a active inhalation, active exhalation. So breathe in and breathe out. You're basically exercising your, lung means pushing it up. You do the hands higher. You bring it down with the Adhi Mudra. The yogic tradition is you do what is called your Ishwar. That's a signal. Ishwar. Ishwar. What we do about 20 times in a slow speed. Then we increase the speed to the medium. That's called a so-hum. So-hum. So, we are completely effortless. We do so long, we do surprised. We do have 400, 500 of them without any effort. Last one you do very rapid is called Vishnu. Vishnu, like this. Vishnu. So you continue this initially only up to your normal breath. The moment you feel the effort in breath, you stop. So don't progress. In fact, if you sit down comfortably, you can always do like this also. Like sit down here, you can do it. This is the gateway of pranayama. It's like taking. Why? My lung is totally empty now. Now if I breathe out, take a deep breath in. Oh my God, I'm taking about almost 3-4 times than my normal breathing. And that is the healing substance. And breath is a connector to your body and mind. More effortless breathing you have, your mind will quiet down. Next pranayama practice which you do is called a Kapalbhati pranayama. Kapalbhati means Kapal is the forehead, Bhati is the shine. It's called basically there is a glow in your forehead. What is the glow? People will tell you. There is an aura around your face. You'll see the picture of Buddha, you'll see a picture of Jesus, there is an aura. And people will tell you, when you do practice with you, see, it looks like you are glowing, you look young. In yogic tradition, it's called your teja. Teja, আমরা বললাম যে তেজ হচ্ছে প্রাণ, তেজ এবং ওজা। ওজা হচ্ছে আমার ইমিউনিটি। আর আমরা এটাকে বলি অগ্নি, জঠর অগ্নি। Indian stomach, this is the stomach, there is a diaphragm, there is a lung. It is an active exhalation and no inhalation. Why there is no inhalation? I don't need an inhalation. The day I was born, I took a deep breath in. Nobody showed me how to take a deep breath in. I need to learn how to breathe out. We practice with different mudras, but let's put your hand in a Adhi Mudra. Then bring your concentration to your belly button. And push your belly button to the back if you can. You will see air will come out. So if you're new to practice, you can put your hand in the belly button. If you push, air will come out. Somebody said to me, nothing comes out. What should I do? I said, it's very simple. Can you cough? Can you show me how to cough? Okay, cough. Okay, cough. Try to cough with the mouth closed. It becomes Kapalabhati. So if you keep doing it, what it does, if you keep doing it here, my eyes are closed, spine is straight. Notice, I didn't breathe.
So, do you take a deep breath, like a deep breath first and then start doing it? Or no?
Good question. I have no idea what I have done.
Okay.
You don't do anything. Your awareness only here. So you are pushing this balloon in, you're hitting the diaphragm, hitting the lung, air comes out. What happens in between, you are breathing without blowing. That is called a passive inhalation. Active exhalation, passive inhalation. It massages all of your internal organs. Massages your liver, massages your stomach, spleen. So all the intestinal contents. So any problem. And after our vital organs, every problem starts here. Udar Karshan. Udar Karshan is massaging your abdomen. এটাকে বলা হয় জঠর অগ্নি। এই ভস্ত্রিকা প্রাণায়ামটাকে বলা হয় প্রাণো প্রধান প্রাণায়াম। It brings প্রাণ in your body. কপালভাতি প্রাণায়ামকে বলা হয় অগ্নি প্রধান প্রাণায়াম। It ignites your agni. So the moment you do Kapalbhati pranayam, they say this is the glow you get in your whole face and body. And everybody who's practicing yoga for a long time, they do look young. Third very important pranayam, I'm also going to show you 2 or 3 more before we finish. I will finish before 30 since you have a time. It's an alternate nostril breathing. What the alternate nostril breathing does, left nostril is controlled by the right brain, right nostril is controlled by the left brain. So by able to do alternate nostril breathing, you're activating both sides of the brain. So what you're doing the balancing poses, it will get better and better. So what you do in the left hand, you do a Dhanu Mudra here, because it's very important. Right hand, just use your thumb just to close your right nostril, not all the way, just underneath that, very simple. Breathe out through your left nostril first. Then slowly take a deep breath through your left nostril. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Now you breathe in through your right nostril. Sorry. Close your right nostril with the thumb, breathe out through your left nostril. Keep doing it, alternate nostril breathing. Breathing through your left nostril. If you guys keep doing it, let me tell you the benefit of this. Left nostril is controlled by the right brain. The right brain is intuitive. Right brain is female. Right brain is cooling. Right brain is parasympathetic. Left nostril breathing is called Chandrabhedi pranayam. It's like a moon energy, cooling energy with the left nostril breathing. Right nostril is controlled by your left brain. Left brain is analytical. Left brain is male. Left brain is heating. Left brain is sympathetic. Right nostril breathing is called your Suryanadi, sun energy, Surya Vedic pranayama. Then once you are comfortable in alternate nostril breathing, again you do until you have any effort, then you can put your index finger and middle finger in your third eye, in between eyebrows, close your eyes and bring your awareness there and keep doing alternate nostril breathing. Within a short time you will notice you have no idea where you are. You are totally detached. At this level, you will see your blood pressure will be down, your heart rate will be down, your blood sugar will be down. And then, to continue it further, you can take the right hand, hold a left hand, hold into your right earlobe, and continue alternate nostril breathing. This is called your super brain yoga. So what is super brain? Continue this and at home, and I will send you all of my YouTube channels. So it is all in my video, so you will see it there.
Thank you.
Okay. Back home, when you see the kid is not doing well, what the kid used to do? হাতটাকে এই করে উঠবস করো, তাই না? এটা ছিল শাস্তি। এরপরে উঠলো, this is the শাস্তি. There is a big study done in MIT. This is your called super brain yoga. It activates both sides of the brain, and the concept was, these are called by the whole yogic Ayurvedic concept. Keep on doing it, this is great. I like it. Okay, I'll tell you what is going to help you a lot in your life. Okay. To stop sometimes. That it's called a observational science. The new this kid, if you put them like this, they will do better. Because the kid who is not doing well, that means what? Imbalance. So the first thing you do, wake up in the morning, okay, and sit down. This is called your Malasana. Squatting. What it does, it relaxes your pelvic muscles, and it keeps your called rectal anorectal junction straight. Normally, what happens? Our stool, we are not going to be incontinent because there is a kink between, and that kink prevents you to have any bowel movement. So here, you straight now. This rectum and anal canal is perfectly straight. Then you take a glass of water, you drink the glass of water in a gulp. Gulp means like big. Akbar khele. Next gulp. It starts with peristalsis. Then when it goes to your stomach, when the stomach stretches, it starts contracting your colon. It's called a gastrocolic reflex. And you will have a bowel movement first thing in the morning. And we are very innovative. People say with this commode what we can do. It's called squatty potty. Anybody seen squatty potty?
Yes.
No? I have it. I have it for years and years. I visit squatty potty. Squatty potty, and we have all the first thing in the bowel movement. The whole day will be great, So then from there, try to get up. If you're able to get up, the sit-rise test, you're 100% functional. If you put one hand, you lose 25%. If you lose two hands, lose 50%. Then your final test, go all the way down. You're blocking her view again. Okay? All of you guys are ready? We'll make a big yogis out of you, huh? Okay. Sit down all the way to the ground now. Got you? All with me? From here, oh my God, I cannot get up. See if you can get up from here. From here, 1, 2, 3, easily you can get up.
Can do it.
Let's try it. All the way down and get up.
Yeah, lean forward.
Okay.
No, just cross your fingers, feet, all the way to the ground.
Get up.
Just get up.
No.
No, not today.
When she can do it.
Not
Just
today.
hip
I can
forward.
get up, but cannot get up with crossing my legs. That's what I cannot do. I have to uncross and then I will get
Now
up.
Christmas is coming,
Yeah.
New Year's is coming.
So that is the resolution. for that
Ah,
time.
it is not coming. It is trying, and you get up.
Okay. Could not even try with my legs crossed.
There is a cardiology study. This sit-rise test is a cardiac function. There's a guy from
Good job.
Brazil.
She's doing it very easily.
Yeah, oh, you have to do other way too. Sorry,
Yeah, I was
forgot
trying to
about that.
practice the other
No,
way.
no, you have
Which is
to,
the other-
because that,
Oh,
that's
the
the
legs, the other.
The other way.
opposite side. You know, see?
Yeah, everything on. Yeah.
Hey, see from here is also opposite side. I'm here. I can get up. Because somebody is sleeping.
Yeah.
Anyway, so sit rise test is a function of your whole cardiovascular system. In fact, for us, it's called a endothelial function. Endothelial function means we have a lining in our blood vessel. It's called endothelium. When endothelium is functioning, and think about it, when the body is tight, the blood vessels are also tight. So you get a heart blockage. I had a blockage in my heart arteries. What is that? My blood vessel is now tight. When it's tight, the lining inside has a little bit of a crack. And inside the blood, what is flowing is all the cholesterol, all the fat and everything, and it gets trapped. And slowly it builds something called a plaque. And that plaque slowly starts blocking the arteries, and then one day, plaque ruptures and you develop acute myocardial infarction or a heart attack. So if you're in a state of, we call it a dilatation, relaxation, an endothelial functions. So now what happens with these three pranayama, your Bastrika, Kapalbhati, and it is called Anulom Vilom Pranayam, alternate nostril breathing. It only happens your body is very relaxed. What is relaxation of the body called? Sthiram Sukham Asana. You enter into a state of meditation. That comes with meditation. So what is a meditation? Meditation is a state where the chattering of your mind goes away. So what's the chattering of your mind? Normally, I have a, your thought process. All the thought process I have, majority is in the past. What happened? Where? Why did he do it? Why should he do it? Rest of them in future. Very little in the present. You don't have any present thoughts, And even all the present thoughts we have, in the over 95% a repeat thought process. What is a repeat thought process means? Yes, I have to come to this Millar library. Address is 9421 Prantik Road, I have to talk to Dipandita. Or she came from India, and now this yesterday morning, is she awake, alert? It's constantly chattering your mind. Okay? In meditation, you enter into the thought process, and slowly enlarge your gap. So how do you do it? Because my brain and body is in a state of a vibration. There is a frequency. What the frequency does, if you trace my brain, you will get an EEG, electroencephalogram. If you do my heart, you will get an EKG. If your muscles got an EMG, this is nothing but a vibration. Actually, when we practice, especially when I practice, we practice with a health tracker. I put an Apple Watch, put a health tracker. So during the practice, you will see all of your health parameters. Now, Apple is coming out with the Apple 10 watch, which is going to give you blood sugar, which is going to give you your sleep parameters, how much deep sleep you have. It's amazing what the Apple is going to talk about. Apple Watch is totally down, is your health parameters. In fact, it is so consistent health parameters is that I've been to cardiology conferences, and the cardiologists are presenting data from Apple Watch. So the sound of Om, A-U-Ma, Om. Om has the same frequency as the frequency of the brain. Why? Two frequencies, when it comes, interacts, it cancels each other. It's called a pure physics, called a harmonic resonance. And what we have done a functional MRI. In functional MRI means, see, before a brain scan had no meaning, because we only did brain scan for somebody had a tumor, somebody has a bleeding, something. And now we can do a functional MRI. Functional MRI means I'm thinking, and which part of the brain is active. You know, I'm meditating. There's a fellow in University of Wisconsin. He has an open MRI, and he even put it on Dalai Lama. A meditating monk, he brings that whole functional MRI, and he showed when they're meditating with the sound of Om, the brain doesn't respond to external stimulus. Like if you give them a light in front, brain there is no activity. If you put a sound in front, there is no activity. And that's what you will see all the rishis and gurus are sitting down and doing that Om. That is called your hand. That basically what meditation will come to you. Unless you prepare your body and breath, meditation will come to you. One best way to do, which we'll finish it doing it, is called a Bhramri Pranayam. Bhramri Pranayam, Bhramri is a bumblebee. It's the sound of a bumblebee. What you will do, you will shut down our five senses. Then we create a sound of a bumblebee. That sound has the same frequency as the frequency of the brain. And when you keep on doing it, you will amaze that slowly you have no connection with outside world. I have some videos, amazing videos. It's, I have almost 100, 200 people, and I'm here, I'm doing it, and the guy's doing a video from here. And each one is doing in all different directions, each one is moving the head like that. Yeah, absolutely there is no connections. That is basically, meditation is not sleep. Meditation is in a state where you get the complete effect of sleep being awake. Because if you can control your vibration. So the technique is, you put your two fingers, index finger on your eyebrows. Use your three fingers to close your eyes. Use your thumb to close your ear and close your mouth. Now you notice what you have done. You have shut down your hearing, shut down your vision, shut down your smell and taste. You will breathe out first, then you take a deep breath in, and you will breathe out with the sound of a bumblebee. Let me show it to you first, and we'll do it about a few times. Breathe out first. Take a deep breath in. practice called pumping and cupping. You keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses and take the hand as like a cup. Put it over your eyes like a cup. What it does, the eyes take all the heat from your hand. It relaxes all the eye muscles. Eye is supplied by 4, call it cranial nerves, the nerves coming from your brain. We call it SO4, LR6, superior oblique supplied by 4, lateral rectors by 6. It's amazing how many can quiet down your mind with your eyes. Then there's a muscle called ciliary muscle. When that
Good evening. The time now is 4:40 and the library will be closing in just 20 minutes at 5 o'clock. At this time, we'd ask that you bring all the final items downstairs to check out. We will reopen tomorrow at 10 a.m. Thanks for being with us today. Have a good evening.
slowly massage your forehead, massage your eyes, massage your face. And when you massage this, what happens? All the muscles here attached to the skin, all the skin line goes away. And then you bring it behind your ear, you massage your earlobe, behind your ear, inside your ear. I don't know if you notice it, when you put a little bit of a stimulus inside your ear, you feel very comfortable. There's a branch called a vagus nerve, auricular branch. It starts your relaxation response. Bring your hand, massage in both sides of your neck. These are called carotid sinuses. We massage carotid sinuses to quiet down our cardiovascular system, nervous system. Bring your hand to the back. Massage all the way back to your muscles. And in a whole yogic tradition, you bring the hands in front of you, bow your head down, and you say, Namaste. Namaste basically is a gesture saying, I honor the divinity within you. You are divine, I'm divine, and this is the beginning of all practice. This is a wonderful Vedic philosophy. Veda has taught us, and it is being diluted and diluted and diluted in the West, but bring it back. Every Western yogis I know, they have entered from asana practice, and people always ask me, what they're doing asana is good. Because when you enter a house, you have to enter through a door, you know? They're entering through the door. But anybody who is there for a longer time, therefore their spirituality is. And spirituality is nothing, but spirituality is a believe in a power above you and just surrender it. So you feel throughout the whole day, you will see your blood pressure is down, your heart rate is down, your blood sugar is down. It is all called a constant, called chattering. Chitta vritti is causing all the dis-ease. Sukher definition in Bangla. তো সবাই বাংলা বুঝে I think, okay. Aprobashi. The moment you get out of your abode, you become অসুখী. এই দেশে যখন আসলে তো সবাই অসুখী। গ্রাম থেকে শহরে আসলে অসুখী। যে গ্রাম থেকে শহরে আসলো, ব্লাড প্রেশারে ধরলো, ডায়াবেটিসে ধরলো। Very common occurrence you see, অপ্রবাসী or rini. Rini means not the Lord, rini means your relationship. That all the relationship you lose, you become অসুখী। Dino sheshe shakahari. Shakahari means not shakahari, shambhari. Actually, the thing is killing us today is not the type of food, it's the quantity.
Too much of food.
You may be surprised. There is a 5 zones in this world called a blue zone, where the people are about 100 years old. And if you look at their diet, it's, oh my God, look at what they eat. One is the Georgia, you know, that Russian Georgia, only on your dairy product. And I think Deepa shared my one experience one time. She said she was in Kenya on a Fulbright scholarship. They said this family comes from your raising animals. You know. Only they eat, you know, what do you say, meat and blood and.
Yeah, it used to be. They just.
No, I'm saying because that's where the tradition it
Yeah,
came
that
from.
tradition,
You know,
yeah.
see, if you look at even a village, people in the village all die at 20s and 30s and everything because of infectious disease. You get a tetanus, you get a cholera, you get like